I have a great opportunity today to address the president of the World Medical Association, Miguelu Roberto Žorži. Let me introduce you to those people who are watching our discussion in social networks. Miguelu Žorži is distinguished psychiatrist, professor, and has worked a lot as a leading expert for the World Health Organization. He is a former president of Associação Médica Brasileira. It means Brazilian Medical Association, and the most influential person in the CONFERMEL. And CONFERMEL means Confederation of Medical Entities from Ibero-Latin America. And he's very friendly colleague and distinguished companion. This discussion takes place across the globe. Miguel is at his home in São Paulo, in Brazil, and I am in Riga, in Latvia, in Europe. As far as I know, Miguel speaks many languages, but we choose English as speaking language because I don't understand Portuguese or Spain. Welcome, Miguel. Be summarized.
Well, thank you very much for this kind introduction, Pēteris. It's an honor for me to be invited to do this interview with you, the editor of the World Medical Journal of the World Medical Association.
Thank you.
I hope this will contribute to, understand a little bit what's going on around the globe during these difficult times we are living with the COVID-19.
Miguel, I will ask you at first about Brazil. And Brazil is one of the countries where COVID-19 has spread very widely. How are you in this difficult time? How are Brazilian doctors in these days? Well,
I think the pandemic has reached Brazil about 1.5 months after Europe. And we were following the situation from Asia and also in Europe. And at the first moment, the Minister of Health was very effective in recommending to everybody, according to the WHO experts, a kind of quarantine to stay at home. It was a law, it was not a lockdown, but a recommendation to everybody to stay home, trying to decrease the speed that the pandemic was reaching everywhere in the country. The pandemic in Brazil started in São Paulo, where we have a huge airport to everywhere in the world. So it reached first those who were traveling to other countries and coming from other countries. But rapidly, the pandemic has spread to other regions of Brazil. You know that Brazil is a very big country with many differences in the regions that we have in Brazil. And unfortunately, one of the places that were not well prepared to receive the pandemic because of bigger, weakening in terms of hospitals and health services was Manaus, the capital of Amazon's state. So the situation there rapidly was a very how can I say? I'm afraid to say it was, almost collapsing in few weeks, the health services there. Mm-hmm. Many people died. And after that, we are seeing that the epicenter of pandemic was right here in my city, São Paulo, which is the biggest city in Latin America.
I think, one of the biggest cities in the world.
I think so. I think so. I think it is maybe among the 10th bigger cities in the world. And the metropolitan area of São Paulo, it's even bigger. We have around 20 million people in the metropolitan area of São Paulo. You know? Mm-hmm. Well, what was a really a big problem in Brazil is that our president was not in line with the opinion of WHO and in the opinion of with the opinion of experts in epidemiology and infectology in all other fields of medicine. I think he was much more concerned about keeping his power and the possibility to be re-elected in 2022, and with the economy breakdown of the country, than with the people that lives here. And he was denying at the first moment the importance of this pandemic. It called it like a small coryza that we can have, you know. And as his Minister of Health was not supporting his ideas that included to give chloroquine to everybody in the country, even with minor symptoms of a cold, no, he fired the Minister of Health. And he nominated another one that lasts,
is away as well.
Yeah, that lasts in the position for 4 weeks. After 4 weeks, again, not agreeing in recommending chloroquine to everybody, he also fired the second minister. And now we have an interim minister as a Minister of Health, who is a military, is a general from the army, no medical knowledge, managing, you know, the Minister of Health and the fighting against pandemia in Brazil. And the president is not showing any compassion for what is happening in Brazil for those who are losing close relatives and friends. And the situation is getting worse. We are now the second country in the world, just losing to the United States in number of cases. And we are actually, at this moment, the fourth in numbers of deaths. But I believe that in maybe 1 or 2 weeks, we will also be the second one in terms of deaths, just also again losing to the United States. I think that is not by coincidence that the president in Brazil and the president of the United States were the 2 most irresponsible leaders, political leaders in the world fighting the pandemic.
I know one more. It is from the president of Belarus.
Yeah, I think we have some other, maybe 1 or 2, but with a big impact in terms of cases and deaths. I think the United States and Brazil are becoming the champions on irresponsibility on that matter. So this is the situation in Brazil now. We have not reached the peak of pandemia. I believe that maybe the peak will come in no less than 2 months from now. So we have difficult times ahead of us to confront our, you know, skills and capacity to deal with what is happening. There are places in Brazil, some cities, some regions, with about 90% of the intensive care units occupied by now, which is almost, you know, collapsing. And we are doing our best as physicians, trying to, you know, have this control as far as possible. But I'm afraid that many more people will die in the following months from today?
I will give some another questions more about your specialty. For me, it's very interesting that you is a distinguished psychiatrist, a professor, long-term specialist for World Health Organization, and we see that there are a lot of problems in your field, and we know that doctors, some from experience from China and Italy, we know that doctors are very certain because they are, it's very common to get sick with COVID-19. And most doctors are very afraid of getting sick, mainly because they can bring the disease home to parents, to relatives, and it is very serious. And how do you think there are not very big problems for psychiatry or psychological situation for doctors in the world?
I believe, doctors are experiencing the same mental health problems that we are seeing also in the general population. Lot of anxiety, fears from distant kinds of situations, fear to be infected, fear to develop a serious illness, fear of infecting, as you said, other people at home, like relatives, fear to die, and fear, particularly from physicians, to not have the power to save as much lives as they wish. So I think anxiety and fear are the two most common psychological symptoms, emotional symptoms that is possible to see among not just among health professionals like physicians, but also in the general population. Besides that, doctors are many times experiencing what we call burnout, a kind of exhaustion at work, with long hours of continuous work, without breaks between shifts, without time to relax or to rest, during one shift, and emotionally very much demanded, particularly when they are facing that there are no enough beds or ventilators in intensive units for all people that they are seeing in the emergency rooms. Sometimes the doctor is being placed in front of, I have to choose who will go to that bed in the intensive care and who I will just provide palliative care. So this is a burden, emotionally burden, besides the physical exhaustion that they are experiencing, that are really causing them many problems. We are seeing in general, I'm not referring particularly to physicians, but we are seeing that people are abusing of alcohol, I think trying to relax, from this pressure that they are experiencing, the fears that they are experiencing, the anxiety that they are experiencing. And besides those symptoms, some of them are also becoming depressed, seriously depressed sometimes. We are listening about anecdotal reports of suicides. We don't know exactly if this is increasing or how much is increasing, but it's something that is concerning us as psychiatrists very much, very much. So mental health during the pandemic is a serious problem. And I believe it will continue to be even after the pandemic has, in a way, decrease its importance in society. I think this will have a big impact on people's life. Some of these impacts will be for the better, but some of the impacts maybe will put people in risk of developing mental disorders. And we are expecting an increase of the number, what we call the post-traumatic stress disorders, because physicians are experiencing traumatic situations, and maybe they will be affected by what we psychiatrists call a post-traumatic stress disorder. So we have to be prepared to attend many people that will need our support.
Miguel, one question from something from psychiatry, but something from your presidency in World Medical Association. The world experience has shown that people tend to dump disconnect and aggression on relatives, doctors, and pharmaceutists in difficult times like these. Doctors around the world often become victims of negative feelings, not only verbally, but also they're physically attacked. What can we do to make the world doctors feel safe of such a moment of tension?
We have seen two different situations on regards of the behavior and the attitudes of the common population towards physicians and other health professionals. I believe that you have seen that in many cities of the world, at certain times of the day, people are going to the windows and applauding the health personnel who are at the front line fighting COVID-19. They are recognizing, the courage and the risks that these professionals are facing when they are many times working in a not very good condition. We are seeing in some parts of the world, in some hospitals, even in rich countries, there was a lack of personal protective equipment. So because of this, many physicians and nurses got infections, and there are many reports of deaths of physicians, nurses, and even the people who work at the hospitals cleaning the spaces are experiencing this. And that population is recognizing this. I think that, as I said, in many places they are applauding, the work that physicians and other health professionals are doing. But unfortunately, there are also, in the other side, probably due to ignorance about the disease, about the conditions of work, people are stigmatizing physicians and health professionals. If you are walking in the street, dressing a white clothes, which identify you as someone who works in a hospital, you can be stigmatized because of that. You can be discriminated. Sometimes I have listened reports that you will not go inside this bus because you will infect everybody here. And there are also some reports of even violence, physical violence against physicians and health workers. There was an episode in a country that I prefer not to mention, where a physician were being buried by his relatives, and they were attacked, physically attacked by lots of people, because that will spread the disease to everywhere in that region of the city. So this is something that concerns us very much. We are trying to publish press releases alerting the people to treat well those who are fighting the disease, because we all depend on the work that they are doing. We have to respect them. We have to reinforce his courage to work for us, you know? And I personally have recorded a video message, you know, to the people, asking them to not do that to align aside of the health workers and not against the health workers. But I think this is a situation that relies very much on maybe illiteracy, maybe medical ignorance, or maybe some socio-cultural aspects of that region in particular. And I think that every one of us has a duty, you know, to try to give knowledge up to people that this is not something that will help the world, but will really harm the world even more during these pandemic times.
Something else from the same situation. COVID-19 had produced fantastic developments of science and research. And every day we get new research, new lessons, new information. There has never been so much contradictory information about one topic as this disease. How do doctors feel about this information flow and how to adapt to it? Okay.
Again, I think there are two things here, two different things, one good and one bad. The good one, I think that we are facing in the previous times many people discrediting sciences, many people against to give vaccines to their children, thinking that vaccines will do harm to them. Many people that believe in that science is bullshit, that the earth is plan, is not around, it's not global. So many people are against scientists and science. And the good news is that because of the pandemic and all the interest and all the fear that people are experiencing with the virus, they are now changing their minds. They are giving more value to science. They are recognizing the work of scientists, and they are expecting as soon as possible a vaccine against the coronavirus that causes COVID-19. So now the world is much prone to science than it was months ago. So this is good news. The bad news is everybody wants to discover the big bullet to kill COVID-19 or to develop the vaccine that will change the picture of this pandemic. And people are proposing all kinds of researches everywhere in the world. And because of the pressure that the scientists are experiencing, sometimes I think those researches are being done not with all the rigor that usually a research needs to be carried out. And then the first results can bring something that is not really true. It's part of science that you do a research today, even well conducted, you publish your results, you have to give the methodology disseminated, others will try to reply your research and can reach different kinds of results. So it's part of the development of science. That's something that looks like in this way today, tomorrow we'll see that that's not true. It's not this way, it's probably that way. So this is part of science. But as we are suffering with this pandemic, many people are dying. The people want a rapid answer. And unfortunately, science do not work rapidly. These things needs to be done with very careful steps. We are some promising research. No, there are previous research is being done with other kinds of coronavirus, not the coronavirus that causes COVID-19. Unfortunately, those research with other kinds of virus, in a way, can be help not to start from zero now to develop a vaccine against the COVID-19. No? So is it possible that we will have a vaccine before the usual average time that takes usually years to appear in the market? I do not believe, unfortunately, it's my opinion, that we will have a vaccine this year. I think it's too short, the time. But, you know, up to now, I think the shortest time to develop a vaccine from the beginning to the end was 4 years. I do not believe that it will take 4 years to have a vaccine against the COVID-19, but I will, you know, I believe that maybe next year we will have something that could help us to avoid being infected by the COVID-19 virus.
Miguel, in your letter to the World Medical Journal, you wrote that the most important thing that COVID-19 outbreak brought to us was the astonishing consequence of how unequal world we live in. It's your words, your comment.
Well, I live in a country where the distribution of wealth is one of the worst in the world. We are a very unequal country, and I can say that we are, unfortunately, a very unequal world. I am seeing, you know, those recommendations of quarantine to you have to do social distance, you have to wash your hands, you have to use alcohol gel, you have to do that, you have to not do that. This is something that could be followed by the most privileged part of the population. We have in every city, almost every city, I can say, in the world, different kinds of people living there. If you take the slums here in Rio or in other Brazilian cities, if you take the banlieues of Paris, if you take cities in Africa or in India or in other Asian countries, even, you know, in every big city in the United States, which I think is the richest country in the world, you will see people that for them it's impossible to be at home with social distance, you know. Sometimes in very small spaces, you have 6, 8, 10 people living together. How do you can be cautious on that situation? Sometimes these people do not have a stable job. They rely on going every day to the streets, trying to earn something that will allow them to buy what they will eat at night. They do not know how it will be tomorrow. And because of the impact that the pandemic is having on the economy, with many businesses being closed, many people being fired from their jobs, I think the situation is very bad at this particular moment. And those who were before the pandemic in a not privileged situation inside our societies, they are suffering much more and they are dying in bigger numbers than we are seeing in other most privileged people. So I think the pandemic is giving a possibility to everywhere in the world to take a better knowledge and be more aware of the inequalities that we are living every day in our lives, in our cities, and all over the world. So I think this is something that the pandemic showed to us in a way that is impossible not to see. My country, as different from what we see in some other countries, is not a country where we can see people doing philanthropy. I know from reports that many people in the United States, when they leave the university after years of a big success in their professional lives, they give money to the university where they are graduated years before. This is not something that happened in Brazil. This, to help others here, it's more a kind of individual situation. It's not something that from the richest people in the society that they give money, to help those that have less. And we are seeing in this pandemic, this movement, even here in Brazil. And I believe this is happening in some other parts of the world. So I believe that solidarity is increasing, in these times. And I hope and I pray for that even when pandemic was in the past, who knows, I want to prefer to believe that this will last for longer than just during this year or next year. So I think this is an important thing that the pandemic brought to all of us that are following the news in the TV or in digital media or social media, and everywhere you can see that kind of thing.
Thank you, Miguel. Thank you very much for your interview. I hope we will meet in the next year. I don't know if we will meet in this year. Who knows? But I hope that Brazil will have a lot of good results with this pandemic, and you will change the ideology of your government, and you will make a lot of good things, and the people will be how good the health can be. I believe it for you and your country.
I want to thank you for this opportunity. It's really an honor for me to be with you here. And I want to leave here a message to all physicians of the world who will see this interview, that we are very proud of the work all of you are doing everywhere with the conditions that you have to work. And I wish also to leave a message to the political leaders of the world to put more attention when they are governing countries in their activities and actions on behalf of health, on behalf of education, on behalf of turning their countries more equal to everybody that lives there. I am very proud to be the president of the World Medical Association in these very difficult times in the health arena. Thank you very much, Pēteris, and I hope to see you soon again.
Thank you very much.